me talking and explaining to them what the scenario is. They have no idea. They haven't obviously seen the stage. Guys, I'm so glad you can hear. We really need your help. What it is what happened was we had this car race, and we don't know what happened. One of the cars went off into the stands, and then next thing you know, there's smoke and everything else like that. I don't know how many people are hurt. I'm just so glad you guys are here. Come on in. I'm going to show you where to go.
Do the fire department coming?
Fire department's in. You guys can come over here. This be cool. They're
Hey, let's tag them. We got 7. Are these stands safe? This thing's safe?
This is all safe. Everything's safe.
Is this a motor vehicle here?
That is a go-kart.
Okay, guys, let's start triage.
All right, you got fire department.
Okay, let's get tags.
Fire department is coming, yes.
Tags coming out.
Sir, man, what's bothering you? Can you hear me? Sir, yeah? All right. Okay, can you walk? Hey, Vinny. Right. Vinny, you got a yellow tag here. Yellow?
Yellow tag there.
What happened? Can you hear me? Sir, what's going on? All right, what happened? Are you trapped here? Can you get your arm out or no?
Sir.
All right, leave it alone. Okay, ma'am. Ma'am, can you hear me?
All right, when you're ready,
walk or no?
we're going
What
to
happened?
need C-spine on him to roll him over.
How are you? Okay.
She's yellow?
The tire?
Yeah.
She's
Sir.
yellow?
Do you remember what happened? You don't remember what happened?
All right.
All right. Hey, let's get him over.
Some C-spine, roll him over. Okay?
I have 3 yellows.
1, 2, 3,
I'm going to
roll it
actually
over.
make him a red, 'cause I don't think he remembers what's going on.
Got his head?
Okay.
Him, dear?
Maintain C-spine on him. Got it.
Let's call for some
Striders
additional
there,
ambulances as well.
He's a red, Carl.
Okay. Carl, we're going to call
Do me
for
a
some
favor,
additional
Joey.
ambulances.
Yeah, there's a lot of additional ambulances out here. So we got 1 red.
Is this the vehicle that's...
Maintain C-spine on him.
I got it.
What do you have there, Carl?
Can you hold
I'm
on
going
to
to
that for
reposition
me?
the airway.
Ma'am? Ma'am, I need you to hold this for me, okay?
No respiration, he's a black.
He's a black? Okay.
He's a black.
So let's do a recount of what we have. We have 1 red here,
I have a red and I have 2 yellow.
a red over here,
Got additional ambulances
2
coming?
yellow,
Yeah, I call for additional
2
ambulances.
greens. and we
Can
have
you hold on to this?
What is she there, Ben?
She's yellow.
She's a yellow too.
Who's your red?
Okay.
He is. Actually, can you
Probably
can
get
hold
out
on to
of
this?
strike team. Let's
I'm going to make him a
on
yellow actually then, because
Let's
he
get
can
our
follow
collars
commands.
Okay,
Let me grab another tag. I'm going to put that one away.
I got this. He made him a yellow, so
I'm
we
going to
got...
make him a yellow. He's
So we're
actually
on, we're
following
on this
commands.
guy. Okay.
All right, looks like he's got
Okay.
some chest injury. Looks like he's
Why don't we get one of our BLS providers on this guy over here? That's yellow.
I need you to
Man,
hold on to that.
another ambulance is on its way. Stay right there, okay? All right. Start taking a listen real quick.
How's his airway? Is it patent, or is he even...
He's got
He's
some
got
abrasions,
stars.
Okay.
some bruising.
Looks like he was ran over by a car. Did you get a look at his pupils by any chance? Non-breather, all right. So far, head injury. You feel comfortable with non-breather? Yeah, start. Oh, nope. Got to ventilate him.
What do you need, suction?
Oral airway.
Stop breathing.
Plan B.
Here's your suction. You need suction now, or are you good?
He's diminished throughout, Carl.
Okay.
I'm going to simulate putting this on
122
oxygen
sign
as
his
well.
tack.
Get an oral airway, please.
Okay.
You got that?
Noting some bruising to the abdomen, chest wall injuries.
Jaw thrust maneuver.
All right, let's get some access on him.
Got the pulse ox on.
I'm not even going to bother. Do you want me to put him on a collar if he's apneic right now?
Just do a modified jaw thrust right now. Let's put an airway in.
You ready?
Guys,
Let me put the airway in. Let me
another
put the airway in.
ambulance on its way. I know you're bleeding. I know you're hurt, okay?
Okay. Good. You got the jaw
Since
thrust?
you guys
Yeah, I
can
got the
walk,
jaw
can you
thrust.
do
I'm
me a
gonna,
favor?
um,
I'm going to have you walk
put a
down here
collar
over
on,
to
too.
a different set of chairs, okay?
All right. You got it?
I'll help you over there.
Make sure these
Give us some
pictures
room.
are- You ready? Good. Am I going in? I don't feel any chest thrust. Do it again.
The other ambulance is on his way. Have a seat down there for us.
All right. I'm having trouble getting this in. All right, he's diminished all fields. Try to tilt him back a little bit. We're having trouble getting this deer in.
41 in title, 85 SpO2. Start ventilating him.
Yep.
Dude, these are not going in.
80 over 40 on the pressure. We could cycle the pressure every 3 minutes.
Okay.
Respiratory rate of 19.
Carl,
These
we
aren't
have-
going in,
we
right?
have a free hand. I'll need a bag spike for him. So we can get some
Yeah, you got
fluid.
chest.
Okay.
He's got some obvious chest wall injuries. We should probably go ahead and decompress his chest.
Okay.
Okay. How you doing over there? Okay, so with me.
Which side?
Help's on the way, okay? We gotta help him first.
Which side do you need decompressed?
Did he go?
Both sounded diminished. Let's just take another listen.
Okay.
I'm gonna
He
measure
might be
this.
just diminished throughout.
Measure it. Yeah. Do we know if he was run over by the car or if
He's
he
got
was
what looks to
thrown
be a
off?
tire mark across his chest.
All right.
Okay.
He's got obvious head injury,
So
nothing in the
we're
back.
gonna
His
assume
spine
chest
feels
wall
intact.
injury for him. When you get that ready, Carl, let me know.
Your bag's ready.
Thanks, buddy. When you need that lock, yeah, there we go. That's it. Okay, let's get an 18 gauge in. 1, 2, 3, poke. Okay.
That's in.
Do we have police on this scene as well?
You all right there, Vinny?
Yeah,
I'm gonna get that.
Yeah, we have
board
police
so I
on
can get ready
scene.
to board him.
Police on scene.
Is that all right?
All right, Timmy.
hit the board.
Our police officer is going to go ahead and need to find a parent for this child under here. Unfortunately, he's a black.
Okay.
Okay. So when that parent's around, we're going to know that they need a little bit of space.
Okay.
All right, when they come.
He's much more diminished than
In the
the right.
meantime,
Go
I'm
ahead and
gonna-
decompress
Why
the
don't we
right
go
side.
ahead and compress that side.
I'm gonna get the board ready.
Just some visual surveys, got a head injury, see spine was clear, nothing on the back.
Fluids open,
Chest,
wide
he's
open.
got the obvious trauma, abdomen, and the left leg.
Okay.
Sharps
noticed.
contained.
Pupils look pearl.
Okay, pupils are equal. Let's get this pulse ox back on his finger and recycle the blood pressure. That's our monitor, right?
Between the second and third rib intercostal and
Okay,
decompress.
bruising to the shin. Still have a weak radial.
Rush of air.
Rush of air, got it.
I got my sharp.
contained.
Let me go ahead and take care of
Squeeze.
that.
You all right, Vinny? You want a break?
I'm good.
You good?
Okay, still sounds like he's got some rails. He's probably got a hemopneumo.
Can you hand me that tape?
All right. We're going to go ahead and need to secure his airway.
Just say when.
All right. You good right there?
I got it ready, Andrew. I can get it in 1 second.
You want more or
Okay,
no?
let me just get my bag for my drugs. Carl,
One more, please.
potential there for a head injury due to the fact that he was probably run over.
Yeah, there's some
Why don't we
obvious.
go ahead and RSI with a head injury protocol?
Okay.
Let's put a
Give me that
nasal
one, please.
cannula on him
All right.
at 15 liters per minute underneath the bag valve. No DSAT protocol for the head injury. You guys still with me? All right, help's coming, okay? Hang tight. As soon as we help him, we're going to help you too, okay?
Carotide's still good.
All right.
Very good.
Carl, one thing.
Good job
I need
bagging,
a
guys.
lidocaine out of that
Let me
bag.
try and get this in.
Yeah, good job bagging.
Good.
There you go, nasal cannula.
Just tape it down.
Check out radials. We might have lost some. He has no SpO2. His end title's still good though.
Yeah, 66 over 32.
Two.
Let's continue to give another fluid bolus, 500 mLs. Okay. We have a nasal cannula in place, 15
Yeah, we do.
liters.
Yes, sir.
We got a bag valve, mask bagging. Carl,
Let's
I
oxy-
need a lidocaine out of the drug bag. I'm sorry, buddy. It's all over there.
Yeah.
What do you need?
The lidocaine out of the drug bag.
I got it.
Pink box. That's it. Perfect. Okay, we'll do a head injury protocol with him. Carl, you go with lidocaine. We'll do a milligram of that.
Milligram. Yep. Pre-medicate.
So I'm ready.
Lidocaine going in. About how much do you think he weighs, guys? About 100 kilos?
He's 100
Sounds
kilos.
about right.
Sounds good.
Okay.
All right.
102.
I'm ready with the tube when you are.
100 of lidocaine in. Okay,
the
keep
capnography.
ventilating him.
This is our chest flutter valve hooked up.
All right.
Milligram of Vec, defasciculating
Actually, I'm
dose.
gonna belong to this.
Here, I'll put it in right in the monitor right now.
All right.
Milligram of Vecin, okay?
Defasciculating dose, watch that heart rate. Milligram in. Okay, we're going to cut the dose of etomidate in half because he is hemodynamically compromised. So he would normally get about 30 milligrams of etomidate. We're going to give him 15. Sound good, guys? How's other patients doing?
That's not hooked up, too, Carl.
Okay.
Yeah, pull the whole thing
Hey,
out.
guys, it's not what we're doing here. Check your pulse.
No carotid.
No problem.
Okay,
no
so
carotid.
let's
Start CPR.
Let's get a or defib valve. I got it. You got it?
Yeah, you keep giving your
Well, that's up. That's up
Yeah,
the
that's
window for
20,
right now.
21, 22, 23, 24, 25,
high quality, good
28,
depth, guys.
29,
High
30.
quality depth.
It's constant, though.
Let's do 2 minutes and then we'll take a look at
Moving
the
to advanced
rhythm.
airway.
And then I'm gonna drop this tube.
You want defibrillator right away or no?
No, we're gonna do, let's do 2 minutes CPR.
Probably coded because he desatted. He's 90 now.
Okay. Here's a pulse. As soon as those pads are over,
Whenever you're ready, I'm gonna take a look.
Ready?
Yep.
guys, who's defib? Carl, who's in defib? Or is in defib?
Lowest setting on the jewels.
Lowest setting.
Lowest setting.
Everybody's clear?
Not
Clear?
letting it catch fire again. You're clear, I'm clear.
Back on the chest.
Let's hold off for now.
Let me know if you need crank pressure.
Here's some,
You want some?
not yet.
Vinny, get ready if you need crank.
Yeah, I know.
Milligram of epi in.
Visualize the cords passing the tube.
Okay. Let me get my scope out just so I can confirm.
Stand by, a little tight going in.
When you're ready.
It is in, it's just tight. I don't know how
And
deep
squeeze
I am.
that back.
Go ahead, bag.
Okay.
Negative epigastric.
Good condensation on the tube.
Carl, he's a traumatic arrest. Let's decompress the other side of the chest.
Okay.
Okay.
Can hook that up.
Continue to have VTAC on the monitor. Okay, when we stop CPR to do a rhythm analysis, if we have VTAC,
Can you
again,
bag
we'll
with one
shot
hand, hold that
again.
tube with one real quick?
Very good.
Okay.
Okay.
Good job.
I'm gonna decompress that 1 second, Andrew. I just don't want to lose this tube.
22 with the blips.
You guys still with me?
Tube secure with a commercial device.
Vinny, you want to switch?
Yeah.
Ready? 5, 4.
Take a look at
Let's take a look at the
take
monitor.
a look, feel real quick or
Okay. You still have VTAC.
negative on the carotid.
Okay. Charging again. Everybody off.
Switch it up. Stay clear.
Everybody off. Shocking right back on the chest.
Go.
Good. Nice switch of compressors. Good work, guys. Continue CPR. Preparing 300 of amiodarone.
This is simulated that it's closed.
Decompressing the other side.
Okay, got it.
Appropriate landmark. We're in. Rush air. I got my shark.
All right, 300 of amiodarone.
We're in PEA.
Hang on 1 second. We won't evaluate that until we do 2 minutes of high quality CPR, okay?
If you need to switch off, let me know.
Yep. 300 of amio's on. Pulse ox on. All right. If we evaluate the rhythm, it turns out to be PEA. We'll go ahead and give another milligram of epinephrine and keep doing CPR. We're going to start to evaluate our H's and T's.
Let's slow our respiratory rate down a little bit. It's showing 40 right now on the end tidal.
All right.
Or on the capnography.
Okay. Let's take a look. Let's get a pulse. Carl, anything?
I have a carotid.
Okay.
All right.
Let's get a blood pressure on him. Got fluids hanging up.
Let's
In
get
the
him
meantime, let's go. You want to get on the board and get out of here? Where's the closest
Let's
trauma
get
center?
ready to do that.
closest trauma center.
Yeah, where's our closest trauma center? Judges? Closest trauma center, 45 minutes. Helicopter? Helicopter.
Let me guess, it's still foggy.
It's still snowing. It's still snowing.
Still snowing?
Okay. It's it doesn't fit with
They're
the
all
collar.
mash bash.
All right. Still got that carotid? Let's
Yep,
get
still got a
blood pressure.
carotid.
75,
Cycle of pressure.
Hanging fluids up. Get an amiodarone drip ready.
Let's get him on the board. We'll get a second line, large bore.
You guys good to get him on the board while I get stuff ready?
Yep.
Yeah. Need
I
somebody
got
to
the
get
head.
coming towards me.
I got C-spine. We'll come towards you. Yep.
Okay. Careful
You ready?
outline.
You got the tube?
We're gonna disconnect the tube, the bag for a minute. On the count of 3. 1, 2, 3. Roll.
Check his back.
Check his back.
Palpate the
Clear.
back. I see
Legs are
nothing.
clear.
You guys still with me?
Tuck those underneath so I don't get stuck.
Bring the board up towards me some. There we go. We'll slide them up one time. Yep.
On you.
1, 2, 3 down.
Down.
Grab the hips and the shoulders. We'll come up to the center of the board. On the count of 3. 1, 2, 3, and up.
Good.
Yep.
We comfortable with that?
Yes.
Bag him. You want to do this then?
Go ahead.
While I get him ready? Get the bag?
Yep.
Okay, decompress both sides of the chest. When the cardiac arrest, have pulses back. BP 94 or 58, we're going to hang it in maintenance infusion with amiodarone. Carl, as we continue to give fluids and his blood pressure remains unstable, cause compressive.
Yeah, we can hang a bag of dopamine.
All right.
How you doing? You good?
Have him intubated
Yep.
already. Just be aware that his pulse is only 42.
Wait. All right.
Good job, guys. Keep up the good
Very
work.
well.
Hey, Carl, why don't you check the pulse now?
I got a carotid. It's faint,
Okay.
but I got one.
No radio.
Obviously bradycardic. We have anything on the monitor with the pulse?
Right now, 41.
41.
Sinus Brady.
Okay.
Okay, I need to get in here for just a second.
90, let's get him in shock position while we're still
Yeah,
waiting
shock
for our to go here, guys. Just throw his bag under the board.
How far out's our BLS unit? And any additional
Okay, that's
resources?
time. Can we give these guys a big round of applause? They did great.
Nice work, Andy. Nice work, Carl.
Right here.
What's that?
Oh, sorry.
Our flutter valve, they put the wrong equipment in our bag, so.
Yeah, I think you did say you visualized.
I did,
the,
yeah, I was trying to verbalize it.
I verbalized a lot of stuff, Carl. It's all right.
Good job.
Nice work, guys. Really nice work. Now we just need to
Okay.
thank you guys very much.
Okay, gang, we're going to bring up Dr. Ford. Before I do that, though, I just want to remind everybody, this evening, immediately following this, there's the Mash Bash right across the hall.
Thanks, guys.
So if you're interested, we'd love to see you there, hang out with you, talk to you, those kind of things. So Mash Bash immediately after here. And Dr. Ford, they're all yours for about 15 minutes. Thank you.
Hello, good night. You guys did an excellent job there. One thing, my name is Dr. Janice Ford Baker. I work at Our Lady of Lourdes Hospital in Camden. I work with Dr. Al Sigeti. A lot of you guys know him. He's a great boss. And I ended up here tonight instead of Al, but that's okay.
How you feel that went?
I wanted to just say, like, emergency medical services is so important because just like this scenario showed, is just that you guys are there without anything. You're not in a ER room, you're not in a resuscitation room, you don't have all your medication, you don't have your suction, you don't have your backup. And you go there, you don't know what you're going to expect. And you have to be able to make these quick decisions that are very important in a short time. And so it's a very, very stressful situation, and that's why it's always good to be prepared and know what you're going to do in a stressful situation ahead of time. In this case, what we'll talk about first is a little bit about the triage that happened. And basically, in like North America, we use sort of the START system, which is sort of like simple triage and rapid treatment. And especially in a case like this, where it's sort of mass casualty, that's the best way to sort of approach the situation so you can go ahead and find out who's your sickest patient and which patient you can actually do the best care for given your limited resources that you have. Here they had about 8 patients. And when the first team came on, the leader, I'm believing the medic, they were very clear, let's start triaging them. And they pulled out their tags and sort of going about to triaging them. And the tags are just based with a color-coded system so you know which patient you have to treat and manage first. Red is for the injured patient, the most critically injured patient. And that patient is already starting to show signs of hypoxia or signs of shock. So they may not be talking coherently, their blood pressure may be low, they may not be satting well. And that patient is a patient that you know that any intervention that you do on them has to be done within the next hour, 45 minutes to 60 minutes, that critical hour to sort of have the best outcomes from this trauma. After red, we have sort of yellow, which are patients that will have urgent injuries. So they can have like a fracture, a long bone fracture, they could have blunt abdominal pain, but they are not showing any signs of shock, they are not showing any signs of hypoxia. So they have a good pressure, they usually can walk, they may have some discomfort, they can talk with you, and they're yellow. They're the patients that they can wait an hour or so before they need to get urgent treatment. So that's not going to be the patient that you take care of right away when you get into a mass casualty situation like this. The next category is green, and that's sort of like abrasions, lacerations, minor injuries, somewhat injuries that even if they didn't go to an emergency department, they probably would be okay, but they are green, they can wait an hour to 3 hours, they have no signs of urgent injuries, no abdominal blunt trauma, and they're to the side, they can wait a while. The next category, which is sometimes hard for us to deal with, especially working in medicine, and we always want to, give our all to our patients, is sort of the black category. And that's a patient where they already have it's fatal imminent injuries. It's not just life-threatening anymore. They're near fatal. They already have no respirations. They are no longer breathing. There are patients where it's not doing an intervention to prevent them from needing cardiopulmonary resuscitation. They're already at cardiopulmonary resuscitation standards. And that patient requires a lot of resources, a lot of time. And if you're out in the field like the medics are here, you don't have all the resources, you don't have the time, and then that patient who's the red patient, time is tick-tocking, going away, where you could be putting in an IV and giving them fluid to resuscitate them, as you're spending time trying to get back a patient that for most purposes has already died. And that is a patient that you have to tag black, even if it's a child, as they did appropriately here. It's just that your resources are unlikely going to change the outcome for that patient. And that's usually different than in the emergency room, because for us, when patients come into the ER, when they code or when they're not breathing, that's when everybody's running into the room and doing everything for them. But it's very different in that setting when you're out in the field. Just a little bit about trauma. The reason why we do this triaging system the way we do, trauma is sort of the 4th leading cause of death in the United States. And beyond that, it's a big cause of morbidity. So, and especially with the age ranges, it's usually 20s to 45-year-olds. So these are, the working, able people of our society, and you want to really help those that you can soon so that they can get back to work, get back to activities of daily living and contributing to society. Does anyone have any questions about triaging or the color system or anything? I know I talk quickly, so. Yeah. That's good.
Okay, thank you, Dr. Ford. I would make one request. This is a CEU event, that you would please give Dr. Ford the respect she deserves and try to listen to her, please, okay, and try not to talk. Thank you very much, folks. Okay? Thank you. Our next team is going to be Valley Hospital and Underwood Memorial Hospital coming in. It'll be about 5 minutes. All right, 5 minutes good? All right. Where is...
Might be after this one. I did very
No, we're not. No, we're not.
ready? Could we have the judges come up front? That would be great, and we'll get started on the next scenario. No, it'd be too loud on the internet sound. Okay, we're going to get started on the next group. Once again, I know it's very difficult to hear in here, and we're trying to work on the sound, but if you could just please keep the noise down, especially in the back of the room, because it makes it very difficult to hear and makes it very difficult for the judges. So again, please try and keep the noise down. We're going to bring in a second team. We have Valley BLS, and we got Underwood as ALS. Guys, we need your help. There was a crash. We had a go-kart race. It was a father-son go-kart race, and they crashed up into the stands. I don't know how many people are hurt. We don't know. We haven't seen yet, but if you guys can come in and check it out. I just didn't know what to do. If you guys could please come up and just check them out. I'll take you up. It's right up this way. It looks like there's a whole lot of people hurt. It's right up here.
We got the fire department coming.
Okay.
Fire department's on
Safe
the way.
guys.
We have additional BLS units coming?
Okay.
Additional BLS units are coming.
Okay.
Is everything safe?
Scene safe up here.
Scene is safe.
Okay. Aeromedical available.
Air medical is on standby.
Okay, how far is the trauma center?
Trauma center is
Hey,
about
guys.
20 minutes away.
Okay.
Who can
fuel,
hear me?
Oils, anything on the ground?
Hello?
Hey, boss.
Okay.
We'll be
What we
right
got
with you in a
there?
second. How you doing there?
Guys,
Hello?
take a look over there, see what we
How
got.
you feeling? Not so good?
Okay.
How about you?
How you doing,
Check
there?
responsiveness on this guy. He's face
What
down.
hurt?
This
Hang on,
guy
buddy.
face down.
Your head hurts?
Sweetheart, can you hear me?
Sir, can you hear me?
Can you hear me?
Can you hear me?
The priority.
What's your name?
Sir, what's our priority? Okay.
Melissa?
Hurts on you.
Okay.
Sir.
Hey, buddy.
Just your face? Okay. Oh, you just stand by. Somebody's going to help you in a second, okay?
Okay.
What hurts on you?
Feeling any pulses here?
This
Just
guy's
your
still
head?
breathing.
Okay. Where were you standing when this happened?
Can you stand up, sweetheart? Yeah.
Okay. Weak? Any problems breathing, chest pain, anything? Okay. How about you,
Very
boss?
weak.
Very weak.
Just
Very
your
weak.
arm?
Okay.
Okay. I'm not really
Okay,
getting any
okay.
What else
chest
hurt you, buddy? What's your
this
name?
one here.
Stop
We
looking
need
at
to
your
get
We
Wait a
need to
minute.
get
What
this
else
guy
hurt you
here.
besides your arm?
All right.
Okay. Do you have any problems in your neck, anything?
Your left leg? Okay.
Fire department's en route.
Fire
Okay,
department's in
can we
route.
get this off of him? Or?
All right, this is what I want you to do.
get him
I got
out.
him
Okay.
pinned under
I
here
want you
to
to
kind
kind
of
of hold your
hold.
arm.
Okay.
Yeah. Is he
Just like that.
conscious?
He is, I got 3 conscious over
Hold
here.
your arm just like
All
that.
right, he's got a weak pulse. We need to get him out.
Okay, we gotta get him out.
Okay, what do you guys need?
Okay,
gotta get him
Josh,
out.
we need to do something. Let's take C-spine on him.
We'll take C-spine on him.
Okay, and let's get him rolled so we can get this kid out of the way. Okay, let's just get him moved.
He's
You got him?
He's got rapid breathing.
This one? Okay,
Yep.
let's just get him involved.
Yep.
You got a C-spine?
I got a sweet spot.
Hold that right there.
On
okay?
3, 1,
And put some
2.
pressure on it. Stay just like that, all right?
Can you pick your head up?
You got him?
There you
I
go.
want that kid Harry there. I need this
Okay.
to get him out of the way.
All right.
Okay.
What's your name,
Tell me
Tom?
what you got there, bud.
Raymond?
I don't see anything
My
in the
friends are
airway.
working with
Can you hear
your
me at
Okay,
all?
you have a BB?
son, okay?
Yeah.
Harry,
I want
can
you to hold this on your arm.
Is he breathing on this kid?
You said we did, right?
No chest rise. I got a BVM over my other bag right
Just
over
get
there.
up.
We're going to take care of him. My
It's as
friends
you
are
see
taking
it.
care of him. Guys, just so you know, I have 3 conscious people over here.
Okay.
I got 3 conscious, burn to the left arm,
I have a
facial
BVM.
trauma. All 3 are
where is
responsive.
it?
All 3 are alert.
Okay.
And
Can you
speech
grab
bag,
my
BVM,
blue
guys.
bag
They need
over
BVM
there?
for this guy.
Can you grab my blue bag? I got a BVM over there.
Okay, sir, can you hear me?
All in stabilization with my knee.
Okay. Keep holding on to his head.
your mouth.
Don't let go of his head.
Okay.
Hold on to his
I'm
head.
holding stabilization with this.
Grab me this bag.
What's your name?
All right, we want to call the MCI, I guess, at this point. Let's see if we get some more ALS units here as well.
Okay, hang tight, brother.
Okay, can we dispatch some more ALS units, please?
Okay, additional ALS units are en route.
Okay.
What's your name?
And how far away from the trauma
Does
center we
anything
said?
else hurt you? Just your hand? What hurt
45 minutes.
All right, let's
your face?
let's get a helicopter in the air,
you?
please.
Just your face? Okay.
Doctor's
your
ETA is
back or neck
about
hurt?
15 minutes.
Where were you on this truck? Where were you?
All right,
Okay,
let's,
I'm gonna need to get it. You
you're
guys want to
sitting?
put in a...
Do you have anything
Okay.
else?
okay, I'm just getting the monitor. Check this. How's his, how's there, okay, pulse ox is on him.
Just got a small burn here.
Right behind you.
Okay, we got an end title on him as well, please. And we got a blood pressure.
I need an airway.
Huh?
I'm gonna need an airway.
Okay, guys, we need a basic airway adjunct for him, please. Any sign of facial trauma to him?
None, I don't see any.
Okay. Harry, you want to work on a line over there?
When you get a second, it's got a compound fracture behind you.
Okay.
You can splint it and just check the bleeding again for me. He's controlling himself.
Okay, just
How's
so you
his
guys know,
respirations, guys?
I have
He's
3
absent.
alert.
He stopped breathing.
Stop breathing,
there.
pulse check, please.
1 is going in and out of consciousness now.
Okay, look at blood pressure on
younger
this,
female.
please. Cycle
He's got-
pressure for me.
All
He's
right,
got
just,
rapid carotid.
just maintain
This
her
one does?
airway. Make sure she's
Okay,
breathing.
Just check that maintains.
Yep. All right. I'm gonna put in this
Okay.
airway.
Scoot to one side as best you can.
I'm stepping out.
Okay, I need some.
All right. So I'm gonna put
As
an
long as you
airway
got
in.
C-spine,
All right.
do the best you can with him.
Airway's in.
Did you cycle that pressure?
Yep, I already asked for it to be cycled. See what it comes up when it does. What do we got for pressure? 80 over 40. Harry, you working on a line?
Okay, buddy, I'm going to put a mask
Okay.
on you with oxygen, okay?
All right.
I'm not going to put it on you. because
Also
we
want to
don't
take a
have
quick listen
oxygen.
for lung sounds here
Okay.
before we do anything further with that.
Hey, Melissa? It's Melissa, right?
All right, we're gonna have to find a way. I want to take a quick listen for lung sounds. See if he's got the ammo. Okay, bag him.
Are you starting to feel tired? Sleepy?
How's your use of bagging right now? We got a pulse ox
Good, it's
on him.
going
It's
in.
not coming up, is it?
Everything's spinning.
86%. Okay, we need to intubate him.
Okay.
I want you to
Okay,
keep talking to her,
scoot one
okay?
side as best you can.
Okay.
so we
Give
can
you a
get
bandage
intubate
for
him,
it?
please.
I'm going to put this mask on you.
Did he take that
Don't
oral
put it on,
air
there's
Yeah,
no
he took
oxygen
it.
in it.
Okay, we know we have
Okay.
Let's do the best you can,
Hang
bud.
tight. Just keep talking to her,
I'd
okay?
like to get a collar on him.
We got a collar in that
Boss,
bag
we're
right
working
over there.
on you, okay? Hang tight.
You want to
Have
hold
any bystanders or
Gotta do
anything?
what we gotta do. Yep.
Do we have additional fire department coming?
Yep.
Additional fire departments en route still.
Okay.
You got him?
Our guy's pinned under
Okay,
this
do the best
truck
you
as
can
well,
with
guys.
this here.
The area has been cleared.
Okay,
Go ahead.
is he breathing?
Okay.
He is breathing, he's
We're
okay?
measuring
Yeah,
his
we're-
3 fingers.
That's fine. Okay.
Just
All right, that's fine. That's
Take care
fine.
of
That's
this.
fine for now. I want to get this guy
Okay.
intubated.
when you get on him,
Okay, his
you need to
stats.
expose him, make sure he doesn't have any injuries. We can't see.
Pre-oxygenate him for me, please.
Yep.
Okay, bag him up a little bit.
Oh, you got a 16 wide open here in the right
Okay,
wrist.
78 over 32. Let's, Harry, check lung sounds for me, please. Let's see what we're doing at least with the basic here. All right, our pulse ox just came off. We had 87%.
Jeffrey, we have no splints,
And
correct?
titles
I don't
43.
see any.
No belly sounds, but he's very diminished on the right.
Okay, with that
diminished on the
drop
right.
each side, you want to consider popping that chest? Okay, all right, you bagged him up good? Okay, let's go ahead and remove that, please. Remove the oral airway for me. Okay, nice job, guys.
Airway's out.
Keep at it.
We're going to make a makeshift splint, pal.
You need cricoid?
All right.
No correct this time, thank you.
Recycle that pressure.
You know what hurts, pal? What's your name? Juan? My name is Mike. What happened? You got hit by that? Okay.
looks stiff. That's the broken
All right, just
tongue.
keep your arms straight for me.
Okay, bag, please. Okay. Okay, Harry, take a listen.
The helicopter's
to,
still coming?
Hang tight.
Take a listen to lung sounds for me real quick too, please.
Helicopter is 10 minutes out.
Okay, are we getting condensation in the tube or end tidal?
Anything on this?
I got sounds on both sides.
Okay, clear and equal bilateral breath sounds. Do I have condensation in the tube?
Right above your ankle?
There's breath sounds on the right, it's almost gone.
How about
Okay,
up
and
here?
let's do end tidal, please.
No? How about right here, pal?
Okay. Let's get this secured. Cuffs inflated. That's an 8-0, about a 23 at the lip.
All right, he's decompressed.
Keep talking to her for me.
Okay,
Melissa,
got air with
Melissa.
Yep.
Open your eyes.
Okay, chest is decompressed. Let's keep an eye on the sats. I'm not
Right
seeing
here,
the sat
pal?
coming up, guys. Check to make sure the probe's on his
Right
finger.
here?
Okay.
Here's good. All right.
Okay, anybody knows any history about this?
Am I seeing any fractures or anything on this, or just as is?
Anybody have
Any
history,
bystanders can tell us
allergies,
about this
meds,
guy?
Anybody?
Okay, let's go ahead and get him secured. Okay, let's recheck a pulse, please.
It's a close one.
What do we
He's
got
a
here?
VTAC.
Okay, he's in VTAC. Okay, do we have pulses with that, or is that pulseless VTAC? Okay.
No,
Hey,
I'm
Bucko, let's jump on the chest.
Feeling a pulse.
All right, let's jump
We
on
need
the
you over
chest.
here.
Yep, we need you.
Okay.
Jump on the chest. You got it. Okay, start compressing. It'll be fast and deep, 100 times a minute.
Hey, Mike.
And
I got compressions for you,
just keep
boss.
bagging about every 12 times a minute.
Pressure's not changing.
Just keep going. Okay, lead end title, do we have it?
2, 4, 3. Now.
How you guys doing over there, all right? You awake, dear?
Melissa.
Melissa, wake up.
We need some resources
Yes,
here.
I requested another bill, as you know.
Okay.
Nobody responded to me.
Get this here. What's the ETA on the remainder of
How
our
you guys
BLS?
doing? All right?
So we've got a closed fracture on the young man that's
Okay,
under the...
that's fine.
All right.
Okay.
Yep, got it.
Okay, keep bagging. All right.
Keep her awake, okay?
Okay, I got this. All right, let's go ahead and get this guy ready to move. Let's get him out of here. I got this.
You got it?
Yep. We're not getting any waveform, guys.
I'm giving drugs, huh?
Harry, you did confirm tube placement with breast sound.
Yes.
Okay.
Epi's going in.
All right, you want to roll towards you guys?
Oh, where's the pads?
I'm not seeing waveform.
Nothing?
I'm not seeing waveform. Harry, do me a favor. As soon as you get
Hold on a second, Bob. 1 second.
Okay, you're doing a good job, bud. You all right there?
Yep, I'm good.
We're on the Harry.
What?
You gotta move that down.
Okay, no, okay. What was that, dude?
I want you to, we gotta move this down, but I want you to also just double check lung sounds again.
All right,
please.
hold on a second.
Is he continuing to bag easily with no resistance?
I'm ready to place the board where you guys are.
All right, we're about 2 minutes. Let's stop. Let's analyze. Let's do a pulse
Hold on.
check.
You guys get clear.
Are we clear? Okay.
me get out of your way.
Step off of him. Step off him. Everybody off.
Hit that charge
Watch
button.
yourself. Harry, is that all right
Hit
there?
the charge button.
Harry, hold
Just
on.
above it.
Harry, stop.
You're all right. You're all right. You're fine.
We're good there?
Yep.
Charge.
We're good.
Okay, go ahead. Charging. Everybody clear?
Clear.
Shock him. Shock.
Shock delivered back on the chest right away, guys. Okay, let's get ready to move him.
All right.
What do you got on board so far?
Epi.
One epi? Okay. All right, guys, let's get him moving. Let's get him out of here.
Ready?
Okay, how we doing over there, dear?
Melissa.
Melissa, you still with us? Okay, that's good. How about the guy on the ground over there?
All right, he's still moving
Hunter
around.
Lido's in.
Okay.
Yep.
Jeff, you see him over there?
Yeah, he's moving.
Okay.
All right, we got a pulse. We got a rate change.
Okay, hold up. We feel for a pulse.
I can't get my fingers in there.
Check ephemeral.
Yeah, we got pulses. We're good.
Okay, we bradycardic?
Stop.
What do we have here?
He's
Okay.
bradycardic now.
Okay, well, it's something for now. Let's go ahead and get him out of here, guys.
All right.
Okay.
Let's
you
roll
gonna
him
throw
on-
some
let's
atropine
roll
while I
him
get
on his
ready?
good
We're
side.
gonna roll this way.
Get him loaded.
Okay.
I'm gonna roll him this way, Jeff.
Okay.
All right, hold on.
Make sure we check his
Stand
back
by
when we
this.
roll him.
Stand
Yep.
by.
Sweep him.
Okay, let's do this as quickly as we can here. Do me a
Begin.
favor, grab that tube.
You're getting 0.5.
Okay, 0.5?
Atropine.
Okay, all right. Let's go ahead. Let's get him moved, guys. Come
Right
on,
behind
let's
you
go,
with
go,
the
go,
board.
go, go. We're holding on baggage
Ready?
for a moment. Okay,
On your
1,
count.
2, 3.
Okay.
Sweep his back.
How's his back?
Nothing evident. All right, move it up, up, okay. Further down, not so far up. Down a little bit, down. Okay, 1, 2, 3. Okay.
How far out's that
Body first.
helicopter?
Yep.
There's about 3 minutes out.
How are we on the pulse?
Still got pulses.
Okay. Do me a favor, since we moved in, Harry, take a quick listen to lung sounds for me again, please.
How you guys doing over there, all right?
Okay, end title's 29. Do we have a sat? I can't see
Jeff,
it from here.
Yeah, what's up?
The strap is under that side.
Okay,
Hey,
I'm
Mike, if
lifting.
you get a second, turn around and look, see if you see a sat.
Negative.
No, it's on the,
We're good.
it's on the other, it's on the fake one.
No, SPO2 still
No,
negative.
no SPO2.
Okay, check, I'll
66 over 56, and
make
title's
sure that
28.
probe's on his finger again.
Jeff,
Can we
you still have the
recycle the
strap
pressure,
around.
please?
I'm bolusing him. You know, we gotta get him covered up too.
Yep.
Okay, you guys okay back here? All right.
Where is he bleeding from? Do you see anything?
Check
else?
his ears. How are his ears? His ears okay? Do you have any secondary injuries?
All right.
Recycle that pressure, please.
Yeah, already doing it. Hey, guys, we need CIDs, please.
Okay. Where's our bag?
Okay.
Should be up there.
Okay, good job, guys.
All right, still got pulses.
Okay, he's got the,
Okay, Jeff, you all right?
yeah, he's gonna get
Okay, Mike, you got CIDs?
I'm looking.
Harry, what you got?
Still got good pulse.
Still got good pulses? Okay. Well, what our pressure come up at? I can't see it from here. It's on the big screen.
66, 56.
Is that the new pressure?
Yeah, do we want
you wanna- is it-
let's try and drop a second.
He's got a 73 on his pulse ox.
Okay. All right, we've got a, how's the other, does
He's
the,
actually
does
up
the
to-
left one look all right
Guys, I
as
just
well?
got to slide this under real
Was there
quick.
any tracheal deviation?
Jeff, we just got to
Yep.
slide this under.
Tracheal deviation?
It's as you see it.
How long will that helicopter got?
SPO2.
2 minutes out to the helicopter.
Okay, 98% on the pulse ox.
66, 56 on the pressure,
Okay.
and title's
If we have
29.
time, we'll drop a second line, hang some
I'm doing
more
it right now.
fluids.
Come across, Jeff.
Come across through there.
All right.
Not over his eye.
His rate went down.
What do we got?
Still got pulses. He's gonna start getting
How
paced.
low is he? You want to pace him? Yeah. Let's throw some pads on.
Helicopter's 1 minute out.
Pacing. Helicopter's a minute out. Let's get ready to get him moved.
Okay.
You want the heavy tape so he doesn't move?
Yep, all right. All right, do you want to check a blood glucose as well, please, just since we have a moment?
Blood sugar is 110.
We're now
Okay.
pacing at 70 beats per minute,
Got him, Mike.
and we got good capture.
Okay, I also want to, while I'm up here, check pupillary response.
They're as you see it. Pupils are as you see it.
Okay.
Guys, I'm going to go
Recycle
check
that
on the other
pressure,
three.
please.
Mike, give me a pen, Mike.
Pen light.
What do we got there? We got the,
Reactive. Reactive.
okay, good.
Melissa, how you doing?
You guys need me to do?
Okay, do we have, what's our end title? Okay, 35 on the end title. How's his sat?
98.
And how's his rate?
How's you still in pain? right
Rate's
now?
coming up. He's at
Rate's
50
coming up.
right now. Just
Okay.
check those. Check his pulses again. Make sure you still
Check
got
pulses,
them.
make sure we're still perfusing with.
And that's time. Thanks very much.
You can't do that with that bone sticking out.
At this time, we'd like to reintroduce Dr. Ford. If you could have your attention, please.
Thanks, guys. Nice job. Thank you, dear. Good job, guys.
Okay, good night again.
Thanks, hon.
Again, if we could keep the noise down, please. In the back, please keep the noise down.
Thank you, guys.
Okay, so in the
Was Nate
first
that night?
section,
How
we
do you
talked a
screaming
little
at
bit
me?
about the triaging system with
don't talk so
START
much.
and using the color-coded triage so you know which patient is the one that you should be
Thanks,
treating
brother.
first. So now you have the critically injured trauma patient, and you have to be able to manage them and manage them quickly and efficiently. So we all know, you know, the mnemonic with the A, B, C, D, E, F, and that's sort of doing your primary survey, and the abbreviations just let you know what you look at first. So A is for airway. So most basically, you want to look if the patient is breathing. You want to assist their airway, so make sure that there's nothing in there, any debris or such, to clear it out of the way. Simple sort of head tilt and chin lift sort of procedures. Now, in this case with this patient, he wasn't having very good respirations. He was breathing very slowly, and given the type of rollover injury, you could suspect that there was head trauma. And if you think that there's head trauma, you want to quickly use like the Glasgow Coma Scale. And it's just a quick assessment that you can do as soon as you go there and see the patient. If he's laying down, he's not talking to you, so verbal's already at least a 2 and lower, he's not talking to you. His eyes aren't opening, and he's not moving anything. We all know, Glasgow Coma Scale, less than 8, intubate. So you know that that patient needs airway protection. Given that he could have some intracranial injuries, there's a chance for vomiting and different things. You want to protect the airway as soon as possible. Now, in this setting, this is not the preferred OR, anesthesia, Malampati score, didn't eat last night. You don't have any of those luxuries when you're dealing with a critically ill trauma patient. So that's why we tend to use, rapid sequence intubation, or RSI, as a maximal way of ensuring a first-time pass when you're intubating a critically ill patient, especially a trauma patient. Now, with the trauma patient, things you have to take into account, especially in this case, being a rollover victim, there's potential, as we said, for head injuries, but also for cervical spine injuries. So therefore, if you're doing any manipulation within the head neck area, as you will in intubation, you want to make sure that you have cervical collar protection. So you want to make sure that you stabilize the spine before you go ahead and doing any of your airway interventions. And the rapid sequence intubation just makes sure that you have a sedative on board and a paralytic, just to ensure that you will have good success for your first pass when you're trying to visualize the cords and secure the airway. The other thing you want to think of, especially in this patient where it's a critically ill patient and head trauma, are any sort of agents to decrease intracranial pressure. We have to probably assume that there's already intracranial bleeding and hemorrhaging, and that's increasing the intracranial pressure. So you want to do things as much as you can to decrease that and to decrease chances of herniation and bad outcomes neurologically. So that's where giving lidocaine, sort of a preliminary dose, usually 100 milligrams IV push before intubating, would help. And just as you guys would know, with intubating for a man, 8 to 8.5 tube, over female 7.5 to 8 tube, and using either a MAC 4 or MAC 3 blade. So we talk a little bit about airway. So now your airway is secured, and the next step that you move on to would be B for breathing. In this case, the critically ill patient has some contusions over the right chest area, and as you've heard with the paramedics up here, decreased breath sounds on one side. So that could be due to trauma and can be due to pneumothorax, and whether it's tension pneumothorax, he's hypertensive, could be due to tension, could be due to hypovolemia because he's bleeding from different areas, also hemothorax. Then there's also flail chest and just pulmonary contusions. And so again, if it's tension pneumothorax, you want to decompress the chest as soon as you can, going the second intercostal space above the rib, mid-clavicular area to decompress the chest, as they did here. Circulation is all about your access and what the blood pressures are. You want to make sure that you have 2 large bore IVs, preferably 16 gauges if you can get those in on the patient, and give as much fluid as you can. So at least it's 20 cc per kilo, an adult male, at least 1 liter wide open, at least one. I mean, a lot of times they're going to need 2 to 3 liters, but at least 1 liter sort of wide open. D stands for disability or neurological disability. And if you're able to get that far in the patient, as you're going before you go to intubate them and you give a paralytic, you quickly look at the pupils, see what the pupils look like, if they're equal, if one is blown, if they were moving anything on their own before you got there. Those are sort of cues. It's all sort of happening all at once. So you can't only go A and B and C and D and E alone. That's why you have a team. And as one paramedic was intubating, another one was putting in the chest tube, someone else is putting in the IV. So these are just all the important steps to happen in concert together. The A, B, C, D, E, F is just for you to just remember it. And E is exposure, and sort of how you saw they maintained cervical spine precautions in turning, but they log rolled the patient. They can look at the back, make sure there isn't any other penetrating injuries or rollover, but what if he fell onto some sort of sharp object, and you would have no clue of that unless you turned him over and saw that there was either something penetrating his back, his spine, or any other areas. And that's E exposure. F is Foley, but that's when they get to the hospital. If they make it to the hospital. Does anyone have any other questions just with the primary survey and sort of the A, B, C, D, E, F?
All right, thank you very much. Okay, Tim, you go get J team number 3 and the Virtua team.
All right, Eric, are you all set? Eric, are you all set? All right. Third and final team for tonight is UMD second team and Virtua's second team. All right, here's what's going on. We're so glad you guys made it today. What happened is we were having a go-kart race, a father-son go-kart race, and one of the go-karts went out of control, crashed right into the crowd. I don't know how many people are hurt. We just called 911, and we're so glad you guys are here. There's nobody else here. Fire department is apparently en route. You can just follow me in this way. I'll take you up. It's right up here.
Okay. Scene safety, is that
Scene is all safe.
Okay, so there's no fluids hanging that's not gonna ignite on us?
No, there's no fluids at all leaking out.
Okay. Okay. See if she's still breathing.
Sneak around.
Hi, ma'am. How are
Head
you doing?
stabilization, let's get him
Can
over.
you hear me?
Okay. I'll take a look at the kid. I'll take a look at this guy.
You wanna roll him over? Let's go.
How you doing, buddy?
Go. Go. Roll him.
How you doing?
Whenever you're ready.
Ready, go.
Okay. Anything else bothering you beside your arm? Okay.
Buddy, how you doing?
We're checking him out now, buddy, okay?
All right, give him some oxygen. He's breathing.
How you feeling?
Not breathing on the
You
kid.
good? What hurts?
No breath on the kid.
Just your hand? Nothing else? Okay.
We got him.
Do you know her?
Is he breathing?
Yeah.
Melissa.
Sir, how you doing?
Melissa. Open your eyes, look at me. How you feeling?
Strong quiet pulses. All right, you know, we
Dizzy?
think she's fine. We think she's coronal high flow too.
Okay. Hang on here, buddy.
DOA.
Okay.
He's got strong quiet pulses, so we're on here.
All right. Gonna need 2 more BLS over here.
All right, we're fine. We're gonna need 2 more BLS.
2 more BLS units? Okay, they're en route.
And what do you need over
How
here?
far is trauma center?
Trauma center is about 45 minutes away. Helicopter is 15 minutes out.
I'll put the helicopter in the air.
Okay, helicopter's en route.
right, we're gonna need a strike team.
What else you got on this guy?
BLS strike team, okay, that's
No,
en route.
No, not talking to us, eyes closed, so I'm assuming he's unconscious. I haven't assessed his people yet, but.
Steve, what do you got behind you? Get BLS to check him
Yeah,
out.
BLS check on them. You guys check on the people behind us real quick?
You check on the, Kelly, you check on the people behind.
Yeah, all right. All right, just check. Can you do me a favor? Just check on these guys behind us, okay?
Ma'am, do you remember what happened? Where were you in the car? Stand? Okay.
I'm gonna get a background mask out. Get an oral airway if he takes it. Alright. How we gonna sit?
Sound's a little bit diminished.
On what side?
Right.
What's that?
Just a little bit on the right.
On this side?
Yes.
Alright.
Ball socks. Where's our monitor?
He's got good rise. He's got good rise on the left. I don't see any rise on the right.
Okay.
So if you want to hand me a trauma kit, I'll decompress yourself.
There you go. We got a BVM out.
Alright.
89%, 80/40. How you doing? How's she doing? She's good? Okay. Let me check on him for me.
Do me a favor. Put this. Down here. How are you doing? Do you remember what happened? What happened? You know where you were in the
132.
Take the oral? Did we take the oral?
BVM.
Yep.
There's a, hand the other guy. No, hand me hand me an IV kit. There's a decompression kit.
What do you need? You got a decompression kit up here.
Do me a favor, squeeze this my finger. Squeeze it inside his tongue.
Guys, don't you fall.
Okay.
Alright, we're gonna decompress straight there and concentration. Do we hear about your air when we go in?
How's your other arm? Do me a favor.
Hear about your air when we go in?
Move your arm. Put it over here.
Keep an eye on that pulse ox for me.
Can you keep it up like this? 1 second, okay? Just something more.
How's the blood pressure? You got blood pressure on him?
Splint it.
Can we recycle the blood pressure?
Yep. Blood pressure is 76/40.
Favor with your good arm.
He's sat at 89%.
Okay?
There's 140 still on the monitor.
Just listen to one side against it.
I'm bandaging his arm from his husband, okay?
How you get for access?
Good.
How's the pulse ox?
It's not coming up at all.
Is that? It's going on here.
Try side of it.
What's his O2 staff?
Got a flash?
It's what is on the monitor. It's not reading at all. There's no
Double
O2
check
sat
your
now.
lung sounds.
What's that?
Double check your lung sounds.
You might set the people top of the guy. Bag it.
Respiration stopped. All right, go ahead, bag him, get ready for intubation.
Oh, we got good lock on the left, but nothing on the right.
How does it feel now?
No, we got
Feels better?
diminished on the right and on the left.
Can you move your fingers?
All right, he's not breathing, so go ahead and bag him, get ready for intubation.
Yeah. Yeah, he still has a cardiac pulse.
Okay.
No, you're good. Just keep on bagging up. We're gonna put a nasal on the arm.
Yeah, I'm good.
Yeah, just lift up for a second.
Sir, what happened? You remember what happened?
Can we get CO2 on there?
CO2 is 40.
All right,
Okay, do
good.
you remember what happened?
Do we recycle blood pressure?
Squeeze my fingers, okay? What's hurting the most right now, your arm? Okay, we're gonna put something on your arm to make you feel better, okay? Can you move your
66/32 for blood pressure.
Running flu was wide open. Served a 300 cc bolus.
What's that? If he's active, I'm gonna go ahead and debate it without anything, right?
Yeah, go ahead.
Okay.
What's the ETA to the other ambulances?
Other ambulance is about 10 minutes out. Helicopter is 13 minutes out.
Very good.
This is dressing we're gonna put right on here, all right? What about you? This your hand? Can you squeeze my fingers? Then you get the other one.
Still got pulses.
Should you pass that go? Where are you sitting? Right here, you were in here when it crashed? Okay.
Just go back.
What about, ma'am,
Just go.
Just open the top bag.
ma'am, you have to sit up,
All right,
okay?
you scooch all the way to the side for a minute. Okay, keep bagging.
What happened? What's hurting you right now? Your head spinning? Okay. Does your head hurt?
Skip my knee. Yeah, listen, he's got, they're diminished here, but he's still got equal parts test. All right, just take the front of this collar off real quick. Call manual, so he's fine. I'm gonna go ahead and do this.
Running the board. Get a board ready also for this guy.
Where's the board?
Board?
Yep.
Right here.
Little quick, Skip. Real quick. Right there. I see the cords.
Pass it to the cords.
Place the collar. You grab C spine again.
Easy bagging. Saw the course. I saw kind of station 2.
I got nothing over the belly. Good. Good.
Now we're gonna go ahead and put inline and title on him. Secure the 2.
What do you want me to do?
No, just hold his head. Just keep C-spine.
Still have good crowd.
All right. All right, there we go. Here we go. What's his end?
37 on the end title. Still nothing on the pulse ox.
All right. We get a second line real quick. We'll hang
Yep.
our thing.
Hanging there for the ball. All right, you want to get him on the board? We'll get a second line. Are you still securing that?
What's that like? It was secure. It came off.
All right. Looks like tack.
All right.
10 pulses.
What's that?
Still have carotid.
All right. No cardioverter.
Sorry. Let's get amio ready for him. Okay.
Still got pulses. Here you go.
Low voltage.
Yeah. For a second.
Trying the best I can over that thing.
Now we're going to charge. Stop the bag. Good.
All clear?
Everybody cardioverter. All right.
End title's 10.
What's that?
End title's 10.
Take the pulses.
Yeah, pulses?
No feeling. Just check real quick.
Ambulances are ETA is 5 minutes. Helicopter is 5 minutes out.
No pulses?
Hold on.
Get the board down and get ready to start CPR.
I have that pulses yet.
Okay.
All right, get on chest for CPR.
Continue bagging.
All right, give me that key.
Epi going.
All right, good.
How's everybody else doing? Everybody else okay? You all right over there, sweetheart? What about your friends? What about you guys back here? Okay. But everybody still talking? Everybody still awake? Nobody's having any trouble breathing? All right. The ambulance will be here in a few minutes for you, okay?
You got the epi. All right, you want to get ready to give him 300 amiodarone?
Yeah.
Hand me 60 look at this read. That's on sound. His end titles. Do a little harder, a little faster. Try and get his end title up. Get going. Get that up. Yeah, let's bring
Alright,
let's
want
hold
the
the
ambulance?
chest. Use that. All right. We're gonna go ahead and defibrillate him.
Low Joel.
Yeah, 200. Biphasic.
No,
Quick defibrillate him.
just verbalize what you would do with
Okay,
that.
we're gonna defibrillate him at 200 joules. Everybody clear? Yeah. All right, back on the chest. All right, we're gonna go with epi, and then we'll give him the epi, and we'll give him 300 around the odor.
You on the switch, Cap?
Are you doing good CPR? We got entitled up to 15. Very good.
I have a
How's the
rhythm
back
change.
lines?
I have a rhythm change.
With that?
Helicopter's 3 minutes out.
All right.
I have a rhythm change.
Why don't we ask this round?
Put them on backward.
Yeah.
All right.
All right, Epi's going.
You want to check his
Give me ambi
pupils?
there.
For the,
We'll let the Epi flush.
Was that? Gave the 300 ammo, I think.
Going in 1 second.
All right.
Amio's going.
Very good. All right, you can hold off the CPR.
Helicopter's 2 minutes out.
End title's up to 24.
I know. I don't have any femoral still.
Yep.
All right, get back. So he's at a PEA. We'll continue with the epi. We're gonna, it's
Okay,
the,
he just had it, so
was that?
he just had it.
That's fine. Just get ready to hang.
Go
his
ahead,
up.
continue.
We're gonna hang.
We'll take a break.
Yeah, we'll get on the backboard, and then we'll get ready to hang our meds afterwards.
Lost one of our leads, too. Lost one of our leads. Black.
We're good. Everything's good. So you know what that will
Somebody got C-spine?
Yeah. Okay. I got him. It's been about 2 minutes.
here, you want me to get
Hey, hold on. Yeah, get C-spine. I don't want to lose it too.
Yep.
Yeah, C-spine. Ready? Clear the back.
1, 2, 3.
Bag is clear. Alright, so we're going to back on. We'll scissor him down.
Ready?
You got him? On your
Yep.
count. Good.
1, 2, 3.
Alright, back up on your count.
1, 2, 3.
Alright, get his body secure. Check for pulses again. Anything?
Got nothing?
Alright, I'll get back on the chest.
Ready for ending?
Yeah.
Our end title's at 22. 13-7.
Just hold off on the...
Check the tube.
Everything's safe.
Check the tube.
Underneath.
Check the tube after the move. End title's dropping.
Get a deep breath. Good. Nothing over his belly. He's doing good all right. Oh, hold on a second. Alright. I got pulses.
Time.
We got pulses.
Excellent job.
All right, we have about 10 more minutes here. We're going to bring Dr. Ford up one last time.
Good job. Good job.
Okay, so good evening again. What I wanted to do now is kind of just run through the specifics for the case that we saw up here this evening with the 3 teams. So it was a sort of a rollover accident at a raceway track. And what happened is a father and a son was in a race car that flipped over into the crowd. A lot of the patients that were sort of initially tagged as yellow, they had some injuries, but they were walking and talking, were up on the stage. Those were the students that volunteered their time up there. So they were supposed to be triaged as yellows and greens so that they can wait. They didn't need urgent care. The child in the car was already dead, did not have any respiration, did not have any blood pressure, and should have been appropriately tagged black. No medical attention should have been given to the child, as was done in all 3 cases. The critically ill patient was the adult, was the father. He had intracranial brain injuries from this trauma and bleeding in the brain, and that was the reason partly for his low blood pressure as well as his bradycardia that he was exhibiting. So key things for him was cervical spine stabilization. He needed to be intubated, quickly airway protection, use of lidocaine or any sort of medication to protect or decrease chances of increased intracranial pressure would have been helpful as well. When you got to air breathing for him, he should have had decreased breath sounds on the right side, and therefore a tension pneumo or possibly a hemopneumothorax, and should have had needle decompression after that. He also had severe abdominal injuries. On the mannequin itself, had a lot of bruising there, as well as a left tib-fib fracture. That is also going to add to the fact that he would be hypotensive. He may have an acute abdomen bleeding into his abdomen, and given with all those injuries, that's why he went into cardiac arrest. And so we saw that happen on each case. Important things with that is that you wanted to make sure that airway was intact and that you already had IVs and set up for circulation so you can start giving medications to treat the cardiac arrest. It was V-TAC, so appropriately to defibrillate as soon as you can whenever you see V-TAC, especially if it happened right in front of them. Get them hooked up to the pads as soon as you can and defibrillate. And you can even defibrillate at the highest dose joules right away in a trauma sort of setting, because you figure his heart has just been pumping away and working hard. Appropriately so, as soon as after you defibrillate, restart CPR, restart compressions, and wait your 2 minutes, and then you give your epi, your atropine, and then see if a rhythm has been restored. And in most cases, after that was done, he would have a rhythm restore. He would still be bradycardic, hypertensive just due to the brain injuries of the bleeding there, and just making sure getting him on the hard board for transfer to make sure that he's still in stabilization for transfer. Does anyone else have any questions about the case or about mass casualties settings or things like that?
Thank you very much, Dr. Ford. I want to thank everybody for coming tonight. I want to again thank our sponsors, Our Lady of Lourdes Hospital, Phillips, and DM Billing, as well as Before and After for doing our makeup, and all our volunteers up here, and Dr. Ford for taking the time to come down here and spend the evening with us. Don't forget about the MASH Bash immediately following here. We hope to see some of you there. Enjoy the rest of your conference, and thanks again for coming. We'll see you next year.